Good day, everyone. In celebration of our Women's Month, I'm here to co-host with Janice Tejano, Attorney Janice Tejano, and we have a special guest today. And because health is wealth, our topic is on women's health. No, this is very relevant to us. And to introduce more about our resource person, our very own attorney, Dr. Vernna Dee Marie Gulle-Familar. She is a registered medical technologist and at the same time currently the medical officer for under the Emergency Medicine Department of the Southern Philippines Medical Center. And she's also the Assistant Chief of Staff for Personnel G1 of the 6th Technical and Administrative Service Brigade of Eastern Mindanao. So she's a medical corps reservist. No? So this topic is very relevant to us. No, this is about the importance of breast cancer and the cervical cancer. So to give more details, let's give the virtual space to our very own doctor. No, so Doc, mag-start ta ani.
Hi, Doc Verns.
What is breast cancer, and share more to us about the importance of breast cancer
awareness.
Awareness.
Okay. May hapon sa tanan. Good afternoon to everybody and to all who will be watching this video, no? So thank you for inviting me to talk about breast cancer as well as cervical cancer for this, which is a very relevant topic for the Women's Month celebration, which is ngayon na March. No? So I chose this topic because this is very important for us, all women, actually to include the men, because breast cancer is not exclusive for women, but also affects male population also. So what is a breast cancer? So this is just a common term for a set of breast tumor subtypes with distinct molecular and cellular origins and clinical behavior. So this is principally a disease of older women, meaning this is supposed to be more than 50 years old and above na age group. However, nag-evolve siya, no? So the breast cancer is not just for the older women. There are many cases which includes female at the 30 years age range or the 25 and above. So it is very important for us to know about breast cancer so that we will be aware and we will be yung dapat tayong magpa-check up ba early, because early detection is better than the late na kasi. So mostly, as an emergency medicine physician which caters to critical patients, we see a lot of cancer patients at the late stage na. So ngayon, kailangan natin siyang pag-usapan so that sana ma-aware ang mga tao and then they will opt to check themselves at an early stage or earlier part of the illness.
Thank you, Doc, for that very murag sa introduction pa lang ni Doc Vernna. Tol, medyo nakulbaan ako. Oh. Pero sakto gyud ka, Verns, no? We always hear about breast cancer awareness. There's even a dedicated breast cancer awareness month. But like you mentioned, one of the things that I picked up from what you just said is in the recent years, mas younger na ang nagakaroon of breast cancer, no? So, although common siya sa 50 years old pataas, but naana po yung mga cases gyud na naana sa mga younger, no, na mga age bracket. So, can you elaborate on that, Verns? And like for us, especially for our batchmates, no, we are in the 40s, we are in the 40s, and of course, I'm sure a lot of our Marian alumni are also interested or may have, napod sila yung mga ing-ani nga mga ginaisip about breast cancer. So, can you tell us more about ngano kaya nagapabata pod ang nagakaroon og breast cancer?
Well, maybe because there are different risk factors kasi, no, that develops or mag-lead to the development of this cancer. So first of all, ang number one kasi natin most common is the family history of cancer in first degree family, like the mother or your sisters or first degree relatives. So if magpa-check up po tayo sa doktor and then mangungulit po kami, kasi part of the history taking is very important to answer the doctor's question honestly, because from there we will know na you are at high risk of developing this cancer eventually, no? So number one, pinakataas na risk, 4 times at risk ka if your mother or your sister has breast cancer. And then 5 times higher if you have a first degree relative who has cancer at an early stage. So, yun siya. Ang genetic at saka inherited. Mga ano kasi to, involvement ng mga genes, genetic mutation. Yung BRCA1 and BRCA2. So, mahirap kasi siyang i-further explain without yung mga pictures. kung ganito lang siya na usapan. So, in short, yung ganun lang, mga genes, inherited, and yung mga acquired na mutations ng mga genes. So, other risk factors naman, if you are a smoker, you have an alcohol beverage drinker, yung grabe, no? And then, sa gaya natin, obese, and then you are using oral contraceptive pills, kasi ang breast cancer kasi is related to the hormones. So, mas mataas po yung hormones natin at this age bracket natin, no? Estrogen, progesterone, those are the receptors kasi na affected ng breast, yung ng gene mutation ng cancer. So, if you are undergoing hormone replacement therapy, and then, yun yung mga most common na mga risk factors for developing cancer. And then, if also you have a relative na may ovarian cancer, kasi yung ovarian cancer and the breast cancer has the same gene na involved, BRCA1 and BRCA2. So most likely, magkakaroon ka din ng breast cancer, or if you have breast cancer, you will also eventually develop ovarian cancer. So yun yung mga premise.
Thank you, Doc Verns. Tol, go ahead.
How will we know ano yung mga basic symptoms or indicators that we need to be tested with breast cancer?
Okay. So, ganito siya. Kasi yung mga babae, di ba, meron tayong mga monthly period. And then, if manotice ninyo, yung papunta tayo sa mga menses natin, may makapa tayo ng mga bukol sa breast, di ba? So, there are what we call as fibrocystic changes, which may be benign masses. So, what the best days after your menses, from the last day of your mens period, you have to recheck your breast. Mga 3 to 5 days after the last day of the menses. So, kapain mo ulit yung dede mo kung meron pa bang bukol. So, ang mga symptoms na titingnan natin ay yung skin dimpling, parang kumbaga kung sa face nagadimple siya. Meron din, if may makita mong nagdimpling yung boobs mo, that is one. And then, syempre, yung bukol, yung number one. And then, dimpling. And then, number 3, pag may makita kang abnormal discharge sa nipple mo, no? Either any discharges, especially bloody discharge. So, that is one also of the signs. And then, skin changes. Kasi kung diba smooth naman yung skin mo, tapos biglang magkaroon tayo ng, ma-imagine yung skin ng orange peel. We call that the orange peel. Diba parang mukhang ano?
Kuno.
Yung
Nasa yung mga, sana.
So, yun, kung ma-imagine yung orange peel, ganon. And then, mga, tawag nito, redness or rash along your breast. No? Ang sometimes kasi, yung mga common misconception ng mga babae ay, is because I'm wearing wired bra, may wire na bra, kaya na-irritate, kaya nag-rashes. Or,
lace.
May nakain lang ako na makate kaya ganun or na insect bites or something. So which is yan naman talaga yung ginagawa natin, di ba? Kati-kati, ganun. Pero eventually if hindi siya nawawala tapos lumalaki and then nag-change na talaga siya, then maybe it's time to go to your doctor. Okay? And then yun ang mga pinakaunang titingnan natin ng mga signs.
Doc, in connection sa mga nabanggit mo about, the signs and indicators and also your earlier discussion about checking family history, genetics. So, would you advise that even before any symptoms, seeing any symptoms, if you know that you have family history, you should already do consultation. You should already see a doctor. Is that something that can be done now in our hospitals? Na even if there are no physical symptoms yet or indicators, but you can genetic testing. Meron na ba tayong ganyan, Doc?
In other countries, meron na siya yung as early as the 20s. I've seen this sa Netflix kasi na parang 25 years old pa lang siya but her mother died of breast cancer and then nagpa-test siya for BRCA gene and then yun siya. So she was advised either to remove the breast or to lang, no? And then, I think Angelina Jolie ba yung nagpatanggal ng breast? Parang prophylactic na pinatanggal niya. Sa atin kasi, if you have a strong family history, pwede naman tayong especially at 40 years old na tayo, at sa ating age group, ang pinakaano dan is yung screening mammography. Kasi yung screening mammography, they can detect small masses ng breast kahit hindi pa natin siya or asymptomatic pa tayo. But then, iano ko lang na before tayo yung mga screening mammography, tayo mismo mag self-breast exam monthly by ourselves. Kasi tayo lang naman yung makakakapa na ating mga breast unless we have boyfriends and husbands. Diba? Minsan kasi sila yung mga nauunang nakadetect. Uy, may bukol ka.
I-delegate na.
So there are ways, there is parang if you want to do the self-breast exam, I can show you. Kunwari, you can do it while standing or while you're on the shower kasi diba parang slide, soapy siya. So, mas madali siyang And then, after yung standing na examination, you can check yourself while lying down. So, parang hindi ba, pag-isapan, gawin ko siya.
Sige, Doc, you can demonstrate. I'm sure naman na for medical purposes, that's very
this is
much
not,
acceptable.
For
This is
medical
educational.
purposes.
Correct.
Yes. Educational purposes. Kasi maraming makakapanood dito. So,
Hindi naman mag-uubad si Doc.
if you are lying down,
Okay.
siya mga klaro.
Oh, sige, Doc. Go.
If you're lying down, so this is your opo. Hello?
Yes, Doc. We hear you.
So this is your nipple.
Okay.
From inside the nipple outward, so kapain mo lang siya with your 2 fingers. Ito. So, circular motion lang until malukop mo siya yung the whole breast. So while lying down, ha. So ganito yung forma mo. The other hand will check the opposite breast.
Okay.
So yun yung circular motion. And then kailangan mo din siyang idiin kasi merong lalo na pang mga dense ang breast, yung malalaking breast, hindi po natin siya ma-feel pag hapyaw lang. So kailangan mo siyang diinan din. Okay? So ganito, circular motion, and then you have to extend your examination here at the axillary area, at the armpits. Why? Because there are lymph nodes and lymphatic drainage connected with the breast. And so, if meron po tayong mga bukol dito, at saka meron na ng mga bukol dito sa armpits, so meron na siyang extension. Possibly cancer with extension na siya. So, magdepende yan sa staging kasi ng yan. So, pwede din kung ganito din, upward, downward motion. Okay? Okay. So, isa pa rin din pala, if manotice mo na magkaiba yung, parang mas malaki na yung isa kaysa sa isa, diba? So, parang isa din yun siya na parang warning sign. So, pwede kayong, while standing up in front of the mirror, pwede mong tingnan. Ang isa, mas malaki, mas maliit siya, or yung pag ganun ka, tingnan mo kung equal pa ba sila. Okay. So, ayan. So, that is one of the examination.
That's a very, your illustration and demonstration na imagine ko na, Tol, no? But you know, I would like to believe, no, that when we were in elementary and high school, we received, or we were also given some kanang overview of this, no? Mo nang tama ba ko, Tol? Tama ba ko memory na 'di ba syempre we go to our school nurse natay mga annual check-ups. Especially itong high school, murag somehow gina-discuss na pod ni. So, I can just imagine nowadays with the technology, diba? So, makagamit na gyud og mga, multimedia, na ay mga pictures, na ay videos. So, the learning ba and getting to really kanang bitong dili ta mataha unsa ba na kanang dili ta, should be a conversation nga dili na siya dapat taboo because this is really something that happens, no? And like what Dr. Vernna said, prevention is better than cure. So early testing is really a must. And then she mentioned about yung mammogram as really one of the best ways to get tested, to get checked, no? At least there is a Philippines natay nga mga capabilities. So, Tol, unsa pa atong other questions kay Vernna? I know na daghan tag mga gibog na questions. Oh.
Yeah, tama dyan. So, if ever na kay doubt, no, with the risk factors that you mentioned, like history, lifestyle and everything, na kay makapa ng mga something, paano ba i-treat ang breast cancer, Doc? So, unsa tong pwede buhaton?
Before ta mo adto sa treatment, no? Kanina nag-mention kasi ako ng risk factors. And then, isingit ko lang din yung tips to reduce the risk. So, di ba kanina ang risk factors, if you're a smoker, you're alcoholic beverage drinker, so yun yung limit your alcohol intake or if not limit, talagang totally tanggalin mo na yun. Kasi hindi lang naman yung alcohol drinking and smoking can lead to the cancer, the breast cancer, it can also lead to lung cancer and hepatic cancer. So, yun siya na, limit or no alcohol if kaya. If kayang hindi uminom. And magsigarilyo. And yun, so do a careful self-breast exam monthly, physical exercise, healthy diet, which is parang it's not for me kasi I'm not on a diet. So, ayan siya. So, control the body weight. So, yun, breast cancer screening. And, ang sabi mo nga, paano siya i-treat? Well, if by doing self-breast exam, may nakapa kang bukol, which is, what are the buckles that you have to, if it is hard, irregular ang mass na nakapa mo, or parang it is adherent talaga siya. So yun, you can go to your doctor, then the doctor will order mga modalities such as diagnostic mammography or ultrasound, and then if it warrants biopsy, then they will do the fine needle aspiration biopsy of the mass, no? Kasi hindi naman lahat ng bukol is cancerous talaga na malignant. Meron din tayong mga benign na bukol, which is yung sinabi ko na fibrocystic changes. So, yung mga labi ng mga taba-taba kanina. Yun. So, but even if sinabi natin hindi siya cancerous, we should still watch out and still continue to have ourselves checked every month. Lalo na if we have a family history. Okay. So, treatment. If nakita naman na nasa early stage ka pa ng cancer, then if ang advice po ng doctor is surgery, then you have to talk thoroughly. You have to ask all the questions that you want to ask sa doctor mo, and then talk it out with your family, because importante kasi yung decision making ng family, no? Kasi yung pala gusto mong magpatanggal ng breast, ayaw ng husband mo kasi wala na siyang makapa. Joke. Joke lang kasi serious naman siya. Diba? Which is, meron talagang mga ganyan na mga instances. Lalo na, di ba? Yun siya. So, kailangan na maintindihan ng husband mo or ng family mo what you are going through, kasi yung support system is very important sa mga pasyenteng may pinagdadaanan, no? Especially cancer, because cancer is not really a minor thing. Yun. So magdepende sa staging ng cancer if kailangan ng surgery lang or kailangan sa advanced na stage yung chemotherapy with the surgery and yung radiation therapy. Yun siya. So, yun po yung mga treatment options.
Doc Verns, naalang ko ipangutana kay Doc Verns because she just mentioned about the therapy and katong mga options, no? Doc, basi gusto makabalo nga to mga batchmates also, no? I'm sure na most of us na atay mga doctors na gina-consult or family doctors na kanang maybe katong doctor pa sa atong parents, nagipasa sa to tong bata pa ta. But para pud mag-guide pud ang atong mga batchmates and atong mga fellow alumna sa St. Mary's, no? Unsa man nga or who to approach? Pwede na ba sila mangutana ani, or should they go directly to the doctor that they're used to seeing? Ana bitaw, because I think isa sa ako lang po ning observation, no, kana laging mahadlok, mangutana nya, maulaw, mangutana about these things ba. Unsa man ang imong masuggest? What can you suggest or advise to our friends na okay, if you think after self-examining that there is a cause for concern or you are concerned, who should they approach? Can they just go to their family doctor and then take it from there? Or would you advise, do you have an additional advice for that or another advice for that? And maybe you can also share, Doc, like here in Tagum or maybe here in there in Davao, di naman promotion, but this is more of information, di ba? At least they will know asa man makaduol na batay mga facilities na kanang mao gyud ni ang gina-cater para makabalo gyud sila asa pod or where, what, and how to go about it. Thanks, Doc.
Well, grabe, lawyer gid kay siya mamutahan na.
Pinahanay.
Yeah. Well, first of all, you should go to the doctor that you are most comfortable with kasi breast kasi yan. So, baka kasi mapunta sa harassment if ever, ano ba. So, kung ikaw mismo sa sarili mo hindi ka comfortable na pumunta lang sa lalaki na doctor or something, so pwede ka naman pumunta ng family doctor mo para to screen again, to recheck if tama ba yung nakita na nakapa mo. Then if your family doctor will advise, oh ganito pala, ito nga pala. So you're parang suspicious mass, nakapa ako doon sa breast mo. Then I will refer you to the specific doctor na ano. Or if not, kung gusto mong dumiretso naman, pwede tayong pumunta sa mga surgeons. But be sure na may kasama ka kasi I don't want to na baka ma-harass, pero this is the most proper way naman. Kasi, syempre nga, di ba, magkubad ka naman, magpa-check ka ng suso mo, and hindi lang, pa siya, i-check, no? Parang
physical examine talaga siya. Okay.
Yes, physical exam. So, anyways, so, dapat may kasama ka.
Doc, can they go to a specialist for this? Or, yung family doctor na or ang mag-refer, or meron bang mga specialist na dapat pwede nilang mapuntahan if ever?
Yung mga kasi yung nag-oopera naman ng mga the surgeons, or yes, and then they can also go to their obstetricians because para hindi lang breast yung ma-examine, we can have our ovaries and our reproductive organs checked also because they are interrelated, sabi ko nga na ano. So breast and ovarian cancer parang magpinsan sila, and they are the most deadly cancers na usually late stage na natin na nakikita kasi nga parang mas mauna pa yung pagpapaganda kaysa sa magpa-check up sa ating mga down there. No? Dapat natin parang bigyan ng priority. Kasi diba, kayo mismo, have you been to your OB gynecologist to have your pap smear and ultrasound? Diba?
Yes.
Oo. Kahit tayo, diba, parang it's not yet the right time. Parang ganun. So we are at 40 years old. We should have our mammogram, our pap smear. Yan.
Thanks, Doc. Yes, Tol.
Tama yun, no? So at the age of 35, I've started checking na yun regularly, annually, no? Pap smear, mammogram.
Especially if you have an early coitus. I mean, you had sexual intercourse at a very young age. So kaya yun, dapat magpa-check na talaga sila.
Yes. So take the advice of the doctor, no? Have yourself checked, no? And in the Philippines, Doc, as the number one common cancer is the breast cancer, but we'll move to the second most common cancer. We'll talk about the cervical cancer. So tell us more about cervical cancer.
Ay, cervical cancer na kaagad. Okay.
Or
Sige, cervical cancer na tayo. Kasi ito, common to siya, no? So, ano yung question mo about cervical cancer? What is cervical cancer?
Yes, unsa po na siya?
Okay. So, cervical cancer, ito siya yung second most common cause of death after ovarian cancer. So, mas nauna talaga si ovarian cancer, no? Cervical cancer. It is caused by a virus, no, double-stranded DNA virus, which is called as the human papilloma virus. So yung human papilloma virus kasi, it's one of the common cause of sexually transmitted infections. So, as we all know, sexually transmitted infection if sexual intercourse without the protection, without the use of condoms, and then yung without knowing the status of your partner, no? Kung ano ba siya. Kasi syempre, yung iba is aminin na natin, yung mga tao ngayon is parang mas hot na. Na-meet lang sa Facebook. Pagkita na, salpak na, kaagad. Diba? So, yun. Is the most common sexually transmitted disease, yung human papilloma virus. So, it is said that 80% of the women will be infected with HPV. But eventually kasi, mailabas nila yung infection, yung virus. However, merong mga instances na nag-persist yung virus inside the genital tracts. No? Ayan. So, 3 to 5% daw mag-develop ng invasive disease. Okay? So, ang nito, there are different strains kasi ng human papilloma virus which can actually cause the cancer. Okay. So, mayroon tayong tinatawag na low risk, the human papilloma virus 6, 11, 40, 41, and 42. Yun yung mga seen sa condyloma acuminata, yung mga STDs. Yung HPV 16, 18, 31, 33, yun, 35, 45, 51, 56, parang loto. Ito yung mag-cause ng invasive cancer. So, if naalala nyo yung tawag nito, Gardasil, yung mga vaccines, they target the specific strain of the HPV.
Doc, meron akong follow-up question. So, is it correct to say that para magka-cervical cancer ka, you have to be sexually active or engaging in sexual activity? So, for example, kung dili ka active or you're not engaging in sexual activity, so dili ka prone aning cervical cancer. Tama ba na siya nga hypothesis based sa imong naingon ka ganina or dili po?
Yes. Kung wala jud ka ever kung wala jud ka ever nag-engage in sexual intercourse, then low risk ka in contracting this cancer, no? So the risk factors, yung sinabi ko kanina, early onset of sexual activity. So ngayon, ang age na ang mga bata ngayon nag-engage na as early as 12 years old. Meron akong napaanak na 12 years old before. So parang bago lang nag-mens, nabuntis na kaagad. Pero 'di ba? So yun. Multiple sexual partners, of course, kasi yun. History of sexually transmitted infections. So kasi there are different types of sexually transmitted infections, but they go hand in hand. Parang barkadahan sila ba? So ito dito si gonorrhea, si chlamydia, si HPV, ganun sila. So those are the common STDs kasi, no? So pag may history ka na kasi dyan, parang yung mga barriers natin doon sa general tract, parang maging, kumbaga, nadunot ba? The barriers are there to protect, supposed to be, from this virus coming inside and developing inside, invading our mga cells inside na naga-protect. But then, if sige-sige kang sex, or yung multi-parity, parang marami kang anak, so yung physical trauma down there, magkaroon siya ng physical trauma and the mechanical factors inside the genital tract will parang increase the chances of the virus going in and developing. Ayan siya. And then, syempre, yung mga oral contraceptive use, and then, mga low socioeconomic status. Why kasali itong mga low socioeconomic status na mga tao? Risk factor siya. Kasi, they are malayo sila sa information. So, walang knowledge. Walang nag-share ng knowledge on what to do to prevent from having these infections and then this cancer. Ayan. And then alam naman po siguro natin na anong ginagawa nila. Yung mga nasa squatters area, no? Hygiene. And then, what they usually do during their spare time. Ayun.
Wow, grabe ang information na na-share ni Doc Vernna. Yes, Tol, go.
Daghan na information overload, pero daghan pagyapon tag gusto ma-learn, no?
Yes, but kabalo ka, Tol, na na-amaze bitaw ko ba kay kaning pero may manggod ko makakita, no? Quite marag popular man ang mga HPV na mga shots, no? Gina-promote yun na siya. And yes. In fact, po yung mga commercials before, I think kita ko sa TV, no? Katong before pa sa pandemic. So, for a time murag na popular yun na siya, but now nako gyud na learn ba from Doc Vernna nga ingon ana ang mga causes, mga factors, and kaning klase nga mga disease ba. Again, dili pud kaayo siya mag-given attention kay sexually related man gud siya, and if dili ta comfortable about mga ingani nga topics, so dili pud ta mag-initiate nga magpa-check or magpa-take og mga mag-take og preventive action, no? So eye opener kay ni for me gyud na ingon ani day ang murag iyahang background. So wala nalingaw kayo ko. O go, Tol, unsay imong unsa man?
Like so vaccine information is really important, no?
Yes.
How about those who don't want to be screened? Unsa atong pinaka best tips sa ilaha, Doc, no? Para how can we convince them to be checked?
Oo. Or idungag siguro ana, Tol, unsa pod ang mga symptoms nga basig na sila yung mga ingani nga sakit or nanay onset sa cervical cancer or mga STD, unsay mga bantayunon, Doc?
Okay. So early onset, yung abnormal vaginal bleeding na kasi diba nagme-mens tayo. If you are used to the 2 to 3 days menses and then 2 pads per day, 3 pads per day, and then biglang may changes sa vaginal bleeding mo, not on the days na expected mong mag-mens, no? So, yung vaginal bleeding, abnormal vaginal discharges, pwede siyang mga any yellowish, greenish, foul smelling or and then there's what you call dyspareunia or painful sexual intercourse. So, masakit siya pag may penetration. Those are just the early signs. Pero those are also signs from meron ding cancer, no? Ayun. Yung late signs, meron po tayong natawag na mga bone pain, back pain, marami pa siya. So, tingnan ko. Yung niya.
So, kuan po siya, no?
Dysuria, yung masakit mag-ihi. Oo, okay. Pero kasi not exclusive kasi minsan dysuria, parang UTI lang UTI. Po. Inom lang ko ng maraming water or inom lang ako ng buko juice, which is supposed to be not the the answer to that. Oo, may dugo pag mag-ihi or may dugo sa puwet, rectal bleeding or pain along the sciatic nerve, and then leg edema, yung parang namaga, swelling of the legs. Yan.
Wow.
Yan siya.
So,
Okay.
listen to your body, Gyud, no? Kung online,
Oh,
wala
yeah.
kayo makitang mga symptoms. So, dili lang i-treat normally ang body pain, back pain. So, naa siya connection sa
Oh, kasi sabi, nag-alasa lang kong bugat or nagtrabaho ko, prolonged sitting will cause back pain and so on. So, marami tayong alibis para hindi tayo magpa-check up. Kaya,
Doc,
yun.
Similar to breast cancer, Doc. So, if ever natay mga ingani nga ma-feel na mga symptoms or mga indicators na makita, how would you advise the patient, no, na unsa may first moadto na ba dayon sa doktor, kinsa ba ang tama nga doktor nga duulan, or can any of the hospitals murag accommodate mga ingon ani na concern? Unsa man ang imuhang advice on that?
Well, if you have symptoms like this, like vaginal bleeding, vaginal discharges, painful sexual intercourse, which is really not your normal, then you can go to your OB-gynecologist because they're the best person to examine you. No? If meron namang mga clinics, kasi mas mabuti yung direkta sa clinics nila, no? And if they have meron kasi mga OB na may ultrasound na sa kanilang mga clinics. So that is a plus. Kasi masisilip ka kaagad. And then, it's up to them kung ano yung gawin nila. Mag-advise ba sila ng pap smear? Kasi yun yung pinakauna. Well, pap smear yung ginagawa, pwede ultrasound, and then depende na kung ano yung findings ng OB. Yan. So same with the breast cancer, they should carefully explain the treatment options, what are your goals ba? Yung anong gusto mong gawin? Gusto ko pang mabuhay. Yan. Yun siya. So then, are you amenable to this kind of treatment option? Are you amenable to this? So hopefully lang kasi early stage. Kasi mostly talaga sa cervical cancer, late stage na kasi sila pumupunta sa amin. So what is the late stage? Yung mga may metastasis na, yung nag-spread na sa other parts of the body. So yun, mahirap na. Yung dating magandang mukha, yung mga magaganda, mga beauty queens na mga patients namin, pagkita mo, oh wow, ang sexy niya. Pero pagdating sa amin, parang hindi na siya. No?
May difference so, talaga.
Yes.
Okay.
So, yun, i-emphasize ko lang din na importante yung vaccination ng HPV. As early as 11 to 12 years old can have themselves vaccinated with HPV vaccines. No?
Dok, ang HPV vaccine, ikapila ba ni siya nimo kuhaon, or unsa ba ni siya, one time lang ba ni siya, or murag every so often?
So far once lang man ang vaccination. Depende sa iyo kasi 'di ba mayroong yung bivalent ng Cervarix. Yung Cervarix kasi targets 2 lang na HPV strain, the 16 and 18. Yung Gardasil naman, quadrivalent. So, 4 strains. The types 6, 11, 16, and 18. Yun yung mga sinabi ko kanina na which can cause the invasive cancer. Yung iba, for your, lang yun, yung mga Oo. And then, mayroong bago, yung nonavalent, yung Gardasil 9. So, it targets the 9 strains of HPV. So, these are available. So, the more strains, the more expensive.
Yes.
Yes.
Okay. So, yung as early as 11 to 12 years old, pwede nang ipa-vaccine, no? And then tayo, lalo na yung mga sexually active na mga kababaihan, pwede din silang magpa-vaccine. And then, i-ano ko lang, if ever naman, kasi ito yung program ko dati sa City Health, yung visual inspection using acetic acid. I was trained by DOH before. So, program ko to siya dati doon, dyan sa Tagum. So, nag-train ako ng mga midwives and nurses dyan sa City Health Office. Visual inspection using just the acetic acid. So, parang meron kaming procedure na ginagawa to check the women kasi it's very affordable. Kasi kung pap smear kasi, you will go to the private clinics or the hospitals and it would cost you thousands, I think. So, itong visual inspection using acetic acid, parang suka lang siya na, I think that was Del Monte. Del Monte na vinegar. And then, yun, i-open lang namin yung, pahigain lang yung pasyente, yung babae, tapos we will do the, may swab kaming speculum exam and then swab and using the so, screening siya. And then if meron kaming makita na mga formations doon sa kanyang cervix, na which is suspicious of this cancer, that's the time i-refer namin siya sa higher institution which is capable to confirm the cancer. So, kasi yung maraming babae dyan na mga the professional sex workers, anong tawag?
Sex workers, yes.
Sex workers and so and kahit hindi sex workers, kahit mga ordinary na babae na they want to be screened at a lesser cost. And they can go to the City Health Office to have themselves checked.
So until now, Doc, available gihapon ni siya nga service until now?
I think na-continue nila. I think so.
Okay.
Hopefully. Kasi it was my...
Unsa ang tawag, Doc, na screening?
It was my legacy, supposed to be. VIA. Visual inspection using acetic acid.
Visual inspection using acetic acid. Noted. Amazing kaayo si Doc og mga gipang-share sa ato karong adlaw, Ethel.
Yeah, no? So Jan.
Yes.
Jan. So dili lang ta malimit no sa private doctors, we can also avail of the publicly available na lesser cost, no. We'll maximize those facilities if
tama. And mas maayog yun tol no nga kanang ma-disseminate bitaw ni nga information. Again, ako ang yung makita no is that I wish that there will be more programs and opportunities for educating women ba, especially kanang naa sa mga low income bitaw na mga areas. Because importante kaayo na aware sila sa mga ingon-ani, breast cancer, cervical cancer, what to watch out for, no? Especially katong giingon ni Doc Vernna ganina na kanang paglayo sila sa information, they lack information, so diha gyud kasagaran rampant ang mga ingon-ani nga cases. Pero tol, kani gusto ko mangutana kay Doc Vernna about sa mga common myths. Diba? Kanang mga tinuuhan na tinuod ba na or dili, no? Kay kaganina wala ta nakapangutana sa iya bitaw. Like nag-mention kaganina, mubalik ko gamay sa breast cancer kay na-mention magul kaganina ni Doc Vernna kananing sa ilok at napasig na adere. Doc Verns, na ako murag nakabasa ko og isa ka myth nga kana bang mga paggamit og mga antiperspirants and deodorants for example, scientifically nabagyod siya or medically nabagyod siya murag connection sa mga cancer, breast cancer in particular, or paggamit let's say og kanang mga napkin, mga unsa pa dinha no, mga kanang mga vaginal cleanser ing ana naaba nay mga effect or naabagyoy research ana as far as you know na naka-contribute pud na sa kanang mga ingon-ani na mga sakit.
Yung mga deodorants, I haven't seen, I think wala pa ko naka-check ng studies kasi ano kasi tayo, evidence-based man kasi
Oo,
tayo, no?
oo, right.
So, yung mga studies na I will get back to you on that if meron akong makita na mga studies na
Sige, Doc.
will tell me na yung
Oo.
mga deodorants can cause
Oo.
breast cancer. But other than that, yung mga sinabi ko na mga, mostly ang number one is genetics, family history,
Okay.
those mentioned earlier.
Oh.
And then, ayan. So, pwede siguro yung mga radiation. If you are exposed to too much radiation, pwede siguro yun. And then, yung sabi mong vaginal cleansers, yung douching, hindi yun siya advisable. Kasi parang, ano siya masyado, harsh. Anything harsh, harsh ang contents,
Okay.
na, syempre,
I-avoid.
ipasok mo siya doon sa ilalim ng vaginal tract mo, no? And then, di ba, yun nga, sexual intercourse and the multiparity, pag marami kang anak, tapos magkaroon ng physical trauma, yung daanan mo. And then, yung the cells there that protect, which is supposed to protect your flora there, yung mga ano mo, yung mga normal vaginal flora mo dyan, mamamatay sila. They are supposed to help to ward off the bad bacteria.
Correct.
Okay,
Doc,
pero sila, kung namamatay sila, wala na silang magawa. And then yun, maging, high risk ka na makapasok yung mga, like
Doc,
the papillomavirus.
na-mention ni mo na mga natural flora dito, no, sa ato ang reproductive parts. Mangutan ako kay, syempre, high-tech na pud baya karon no, medicine. I mean, nag-level up na pud baya ang ato ang mga technology. As far as you know, nana ba yung mga replacement ani or something like kanang mga therapy, kanang mga oral therapy para, for example, daga na ka og children, kapila na ka ng anak, ana. So, possible ba kung isa na sa mag-cause nga kanang ma-damage tong imuhang sa ba diya reproductive kaysa sigig panganak, and it can be murag maka-cause na siya, additional risk factor. Na ba yung mga, I don't know, kuan karon procedures or kanang medication na available na to improve siguro kanang mga ana bitaw nga mga concerns, or wala pa?
para mo gwapa balik ang imo.
Oo, di ba? Mo gwapa or mo healthy siya ba? Mo viable siya o balik. Unsa bitaw? Wala ko kabalo sa tamag term ana, pero na may mga ingon ana, Doc?
Honestly, wala pa ko kadungog kingana. Siguro I will do further research on that.
Okay, sige.
Unless yung vaginal reconstruction.
Oo.
Pero siguro maybe vitamins and then good proper hygiene will do, no? Tapos like after sexual intercourse, you have to wash it properly, and then avoid having multiple sexual partners.
Mao jud na, gigikabila jud na. Ikapila jud na ginabalik-balik ni Doc Vernna ba? So noted na ha. Okay, mga higala.
Yes,
mga higala na to diha. No to multiple sexual partners. Okay.
Yes.
So, Tol, murag, we have really gained a lot.
Can I add?
Yes, go ahead, Doc. Go
One more
ahead.
lang regarding yung sa pap smear kasi, di ba? When is the best time to have pap smear? Kasi, syempre kayo, nagpa-pap smear na ba kayo?
Yes.
Di ba? So, what about the others? What about our classmates, our schoolmates? We are all girls in the di ba? So, according to this, based dito sa OB na recommendations, yung cervical cancer screening guidelines, di ba? Mayroon akong kodigo. Women, age 21 to 29 years old, pap test alone can be done every 3 years, no? So, HPV testing is not recommended yet. Then, women age 30 to 65 years, pap smear and an HPV test, no? Co-testing every 5 years is preferred. But pap smear can be done every 3 years. Yun. So, hopefully, na gets ng makinig, no? at
Pap
this
smear
age,
every 3 years.
30 to 65, every 3 years, or every 5 years kung pap smear plus HPV testing.
Do ka ng pap
Ayan.
smear, maski dili ka sexually active, ana, dapat at that age, 30 to 60, nagapa-pap smear every 3 years.
Yeah, wala jud totally nga wala jud.
Dili ba kay basilag naay mo ingon di
Yes.
ba kay kasagaran daghan ba kayo mo
We can
ingon
also do,
ana.
yes, we can
Mm-mm.
still do the pap smear because dili lang man siya ang cervical cancer ang pwede. There are still other cancers in
Cancers.
the reproductive area, the reproductive organs.
Okay.
Yun siya.
Thank you, Doc Verns. Tol, I think daghan na kaayo uta og na learn kay Doc Vernna, no? Murag grabe kayo, valuable kayo ni nga discussion gyud with her, and we really learned a lot. I mean, I'm sure kita tol, no, and our batchmates, we have been, watching all these mga kanang mga maski mga videos sa YouTube or asa pa ta makakita og mga information about breast cancer awareness and cervical cancer. Pero lahira gyud bitaw na to ask one of our very own nga,
Yes.
'di ba, licensed professionals, and Vernna is really kanang in touch kayo siya ani because as she has mentioned to us at the beginning, na kanang normally pag makahandle sila gyud og patients na nasa late stage. So she is really concerned nga dapat early good prevention is so much better. So ako, Verns, I'm very, very thankful sa tanan ni mo nga na-impart. Thank you so much for everything that you have shared with us. I am very grateful and appreciative. I've learned a lot from this conversation. And this is really the, I think, objective na to, tol, diba? Because
Yes,
we
God.
want to empower our batchmates, our fellow Marian alumni, na siguro wala pa po sila kabalo sa uban ng mga insights ni Doc Vernna. So, grabe kayo ang akong learnings karon. Tol, what can you say?
Ang you-mention na ko kaganina, wag mahiyang magtanong, no? It's better to listen to your body. We have available resources, no, like si Vernna, our very own, so we can really ask. But of course, it takes some courage for those who are undergoing through it, na baka nasa denial stage pa. Pero mas better na early detection, no? If not kung dili prevention, at least early detection na para naapatay time to correct whatever. No? So, daghan jud kayo tag natulan jud kay Vernna, no?
Doc Verns, ready na ba ka nga daghay mo text sa imuha or mag-PM?
Yes. Napad ko i-add.
Go.
Parang, kuan siya kasi, I was invited, yesterday, nag-lecture din ako sa Army, sa battalion sa Fort Bonifacio about this breast cancer and ovarian cancer na for their awareness campaign for the International Women's Month. So, days ago, while doing the PowerPoint slides, and parang na-review ko siya. And then, I remembered, I have a first cousin na nagkaroon siya ng breast cancer, I think stage 3, at 30 years old or 35. So, anong sabi ko kanina? If you have a first-degree relative who had cancer at an early stage, kasi diba more than 50 years siya dapat. So, early stage, early ang kanyang onset ng cancer. So, napaisip ako, that makes me 5 times ang risk ko. Oo, ng ano. And sabi ni Ethel kanina, listen to your body. I know marami akong lumps. But then, parang sinasabi ko, ay kasi magme-mens ako. Kaya, maybe this is not what I'm thinking.
Right.
So, really, it's important to listen to your body. And then, your family history is very important. So, ngayon, natatakot na ako.
Doc, we understand. Pero I'm sure that you will take action on that, no? Kay ingon gani ka nga, recent na realization. Doc, siguro lang pod para dili lang pod kaayo murag makulbaan ng atong mga batchmates. What words of encouragement can you share to them, no? Whether they are already murag nagasuffer sila karon sa any of these types of illnesses or murag kana na sila yung mga family history, unsa ang imong ma-share sa ilaha nga words of encouragement nga para makatake sila sa next step, and if ever naga-go through na sila ani karon nga mga process, unsa man ang ato ang pwede maikasulti sa ila pod nga words of hope, unsa bay naa?
Well, sa mga naigipang bati nga wala pa nagpa-check up, sama sa ako So, sabi nga ni Ethel kanina, prevention is better than cure. Pero, hindi tayo baka ng prevention eh. Early stage is better. So, detection at an early stage is better than the late stage. So, we should have ourselves checked earlier. Kasi nga, iba ang treatment options. Kasi kung early stage pa, pwede namang surgery lang, no? Mastectomy, modified radical mastectomy, whatever. Tanggalin lang yung boobs and then if okay lang yun siya. Meron din naman tayong tinatawag na prophylactic na mastectomy, pero I think sa Philippines parang mahirap pa siyang intindihin na tanggalin pa yung boobs na hindi pa naman nagka-cancer. But then, sabi nga, okay, kasi kung late stage na, we will undergo chemo, or kung very late stage na, yung hindi na matablan ng chemo kasi kalat na. So, mahirap na po siya. For those undergoing or yung meron na, diagnosed case na, mahirap kasi siya pag sabihin natin na be strong. Pray lang tayo niyan. In those words cannot actually help. No? Kasi, syempre, andyan na yan sila, nagpre-pray na yan sila, they're trying their hardest to be strong. Ang importante lang siguro to have family support, the friends. Pinaka-importante na yung mga friends ng mga may sakit should be there for them. Hindi yung sana may yung friends ko, sana may mga natulungan ko na I'm at this state na I'm so down, I'm so depressed, I am sick, I'm very sick, I have nothing. Kasi mauubos din talaga yung pera mo sa mga procedures, sa mga treatment. So, diba? We should always be there for them kahit wala kang matulong, pero meron lang silang makakausap. Somebody who can understand what they're going through. And it means a lot. No? Wag na natin hintayin na sila yung mag-text una. Kumustahin natin sila. Just, kumusta ka na? Anong gusto mo? Prutas? whatever we can uplift their spirit, their moods, diba? Oo. Kasi mahirap sabihin mo, pray ka lang, be strong, hindi kayo nakakatulong actually.
Doc
The more they
Verns,
get depressed. Oo.
Wow, that's a very powerful na message, but at the same time, tinuod yun na, no? Imong giingon Doc Verns na presence yun and support needed, no, from family and friends, whoever, kung kinsa man ang mga go through og mga ingon-ani nga mga challenges. So I'm very thankful sa tanan nimong na-share, Doc Verns. Yan, and Ethel is back. Okay, diba?
Sorry, I'm out.
It's okay.
I may not be the very best person or the specialist, no? Kasi OB gynecologist should be the best person to talk about the cervical cancer, ovarian cancer. Pero at least I have this knowledge to impart to you. Parang para
naka-experience and encounter na gyud pud ka, Doc, og mga patients na sa ingani nga mga cases.
Oo.
So, Doc,
mga critical stage na.
Yeah.
Kawawa.
Tol, I think that grabe gyud atong pasalamat kay Doc Vernna, no, sa kaning iyahang paggahin og oras for this conversation in celebration of Women's Month. very valuable, helpful information. And I'm sure that our batchmates, dili lang sila ma-surprise na naingon ani, but I'm sure that they will learn a lot from this, Vern. So thank you so much, Doc Vernna Gulle-Familar. So daghan kayong salamat, Verns. Thank you for all your support to our activities for the alumni homecoming. Thank you so much, and ingat permente sa imuhang mga activities din ha. Doki, thank you kayo.
Sana dili pa ka mag-say no sa mga next opportunities.
Correct.
No? Kulang actually
as long as makatabang. Yes.
Oh, yes.
You know, I
Ako
want to help people.
Thank you, Doc Verns. Thank you. And that is a wrap for our conversation with our dear Dr. Vernna Dee Marie Gulle-Familar. So watch out for our next guest dire sa atong Tatak Marianista Women's Month celebration. Thank you, everybody!